Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today I'd like to share with y'all some COVID-19 decision trees. As I've mentioned before, I'm on the medical advisory team at our school. My kids go to a small private school here in town, and at the beginning of the summer, I worked with several physicians and someone involved in policy to help develop decision trees that were easy to follow as students and faculty had questions about COVID-19 throughout the year. I still get numerous questions almost on a daily basis from friends and family, and I often refer to these decision trees, so I'd like to share them with you. Let's start at the top of the decision tree. If someone starts to experience COVID-19 symptoms, they are to notify our school. They then have three options. The first option is to obtain a physician note excluding COVID-19. Option number 2 is that they can get tested for COVID-19 and receive a negative result. They can use either a nasal pharyngeal PCR test, which usually takes about a day or two to get back, or if they're getting tested within 5 days of their symptoms, they can get a rapid antigen test, which just swabs the very front of the nose and usually gives results in 15 minutes to several hours. Option number 3 is that they should isolate for 10 days. But before returning to school, they must be fever-free and symptom-free for 24 hours without using any medication. The next question that I have is about exposure. There are lots of questions about exposure. What defines a true exposure versus not an exposure? And I still think there are a lot of nuances to it. At the end of the day, it is exposure of 15 minutes over a period of a day with someone who is known to be COVID positive. Now, I do think some things like whether the exposure was indoors versus outdoors and whether the people were wearing masks need to be taken into consideration. But if someone has a true exposure to COVID-19, they have two options at our school. The first option is to quarantine for 14 days. The next option is to get tested. However, both of them still result with needing to be quarantined. It just is a matter of for how long. If you're tested and you have a negative result, you still have to quarantine for 14 days. However, if you get tested and have a positive result, you need to isolate and wait 10 days before returning to school. However, you must have no evidence of COVID-19, meaning you must be fever-free and symptom-free for more than 24 hours. Now, let's focus a little bit more on the get tested part of the decision tree. I'm hoping that at some point we can allow people to return to school after they wait 6 to 8 days after exposure and get a PCR test. But that's really the only test that I think would be valid after having an exposure, because we know that when patients are asymptomatic or don't have symptoms, the rapid antigen tests just don't seem to work as well. I've been alarmed at our independent school district using rapid antigen tests on asymptomatic people to allow them to participate in extracurricular activities. I don't think that's a valid use of these tests, and I have concerns about it. So, if you've had exposure, but you're asymptomatic, you need to wait 6 to 8 days after exposure and then get a PCR test, which is the nasal pharyngeal test, which is the one that's uncomfortable, goes very, very far back in the nose, and usually takes about 12 to 24, sometimes longer, hours to get back. Furthermore, at the bottom of our decision tree, you can see that I've streamlined the COVID-19 symptoms just for ease, and also we've defined the fever guidelines. And furthermore, we've also defined exposure guidelines, but like I said, there are a lot of nuances associated with exposure. So at the end of the day, a lot of times it requires a conversation with someone about whether it was a true exposure or not. Now let's move on to the second part of the decision tree about members in your household. What should you do if someone in your household is experiencing COVID-19 symptoms? Well, we ask the parents to monitor carefully the student before sending them back to school. But if the patient does not exhibit any COVID-19 symptoms, they are welcome to come back to school. However, if they start to show symptoms, then they need to return to the other decision tree that I just talked about. However, if someone in the family tests positive for COVID-19, everyone in the household needs to quarantine for 14 days. I'm hopeful that at some point we can allow the PCR testing after 6 to 8 days, like I mentioned before, but that's assuming that you've removed the person that's COVID positive from the household. And I know that's really hard to do. So at this point, we recommend if anyone is positive for COVID-19 in the household, everyone needs to quarantine for 14 days. If you develop symptoms during that time, you need to return to the previous decision tree that I talked about. I hope this is helpful. I know there are lots of questions and there are ongoing recommendations that change, and I'm providing them for you as well with the hope that they'll be beneficial for your business or your school. Thanks again for joining me.